Joint symptoms may signal a serious type of arthritis, which can cause some permanent damage if treatment is delayed. According to data from the U.S. Centers for Disease Control and Prevention, inflammatory arthritis has the potential to turn into a quality of life epidemic. The disease is characterized by pain, swelling, warmth, and tenderness in the joints, as well as morning stiffness that lasts for more than an hour. Right now, an estimated 52.5 million U.S. adults are living with the disease, and as the U.S. population ages, the number of adults with arthritis is expected to increase sharply to 67 million by 2030. If detected and treated in its early stages, the effects of inflammatory arthritis can be greatly diminished. Dr. Rohan Watson, radiologist at the Center for Medical Imaging, explains how MRI is used to diagnose inflammatory arthritis.
The patient may start at their primary care physician, as many patients do, and depending on the comfort level of the primary care physician, they may order some of those basic tests, or they may sort of refer them right away to a rheumatologist, an expert in the joints. And sometimes it's very, very clear that the patient does have an inflammatory arthritis, but for many patients, it's not clear. MRI has evolved to play a potential role in helping to diagnose these patients. On MRI, there are three main findings that we are able to detect in patients that have inflammatory arthritis. The first is synovitis. What is synovitis? Synovitis is refers to an inflammation of the lining of the joint. Patients with an inflammatory arthritis, a greater volume of fluid is produced. It has also become apparent that MRI may not only aid in the diagnosis of patients with inflammatory arthritis, but it may also have prognostic information. Patients who at baseline, that is at the time of initial diagnosis and presentation to imaging, have marked synovitis as revealed by marked thickening, those patients also tend to have erosions at an earlier stage and perhaps within a year. And so the implication is that MRI potentially may play a role in helping to stratify patients into those who are potentially may have more aggressive disease processes. And therefore that information may be useful to the clinician to try and decide what kind of therapies to institute.
For information on the board-certified radiologists at the Center for Medical Imaging, or to find out more about their numerous imaging procedures, please click the Find Out Early story link icon on our homepage, yourhometownhealth.com.